Hi, my name is Jennifer Jones, and I am so proud to be part of the University of Pittsburgh Graduate School of Public Health Concept Mapping Institute. I first learned about concept mapping when I was a graduate student here, and I used the method as part of my community engaged research project for my MPH master's thesis. Since then, I feel very fortunate to have been part of 6 concept mapping projects, and I've co-taught the method with Jessica Burke to over 75 students. I love that there is structure yet flexibility built into any concept mapping project. It seems a little bit like an oxymoron, but given that there's 6 steps and such a wide range of stakeholders and questions and health topics that you can focus on, every concept mapping project is truly unique. Given that the analysis components are so visual that you can share them with the participants, it just creates this really great space to generate rich discussions. It also facilitates transparency and trust building with your participants or your community stakeholders, and it allows you as a researcher or a facilitator to lead to new knowledge, and you can utilize the results in a lot of different ways. Over the next few minutes, I'm really excited to introduce you to some of my friends and some concept mapping, community, and academic partners who have used the method here in the greater Pittsburgh region. You'll be able to learn from their experiences to hear what worked, what didn't work, challenges, successes, and some maybe unexpected outcomes.
I'm Donna Dobler, and I work for UPMC Health Plan.
My name is Michael Jonas. I'm a Director of Research and Special Initiatives at the Pittsburgh Foundation and an adjunct faculty member at the Graduate School of Public Health.
My name is Gabriela Mendez, and I was a student here. I got my MPH here at the University of Pittsburgh.
My name's Sarah Sanders, and we did the concept mapping project through the Midwife Center in partnership with the Midwife Center for Birth and Women's Health, and I'm also a doctoral student here at the University of Pittsburgh.
My name is Ruth Modulewski. I am the mission coordinator at Susan G. Komen, Greater Pennsylvania.
So my name is Jessica Thompson, and I'm currently a doctoral student in the Behavioral and Community Health Sciences at the University of Pittsburgh Graduate School of Public Health.
So over the course of the past 10 years, when concept mapping has really been utilized here at the University of Pittsburgh and in our region, there's been a lot of experts who have used the method either as a researcher, as a student, working at an organization where they thought concept mapping would be beneficial. So they couldn't all be with us, and we still thought it was really important for you to hear their perspectives and hear about their concept mapping experiences. So they all sent us some short videos.
The strengths of concept mapping. I always joke that I would love to concept map everything if I could, but it turns out it's not appropriate to do that. But the reason that I love it and the reason that I say that is because there are so many strengths.
My initial reaction to concept mapping was just, my mind was blown. I'm a geek for theory development. And so while I hadn't grasped all the elements of concept mapping, I was instantly attracted to it as a research method for its ability to develop theory and generate hypotheses. In addition, I also liked the fact that it is a systematic way for a diverse group of stakeholders to come to a consensus, and it's a mixed method, so it has the best of both qualitative and quantitative methods.
Typically, we could do surveys, we could have focus groups, but all of that seemed to be very time intensive. We weren't exactly sure how to corral a good large group and large enough people to actually represent the community. So when we were introduced to concept mapping, we thought that might be actually a neat and innovative way to actually mix quantitative and qualitative approach to getting community input.
My initial reactions to concept mapping was that it was a really interesting research method because it brings so many different components together in one study. So especially when you're thinking about a dissertation study, it was bringing in quantitative elements, it was bringing in qualitative elements. You were getting both group level data, like a focus group, but you're also getting individual level data, which is very interesting as part of your data collection. Also for me, who had very little experience with community engaged research or community-based participatory research before being in the PhD program, the structure that concept mapping provides, which facilitates that community engagement, was really appealing to me. So I really appreciate the structure of concept mapping and how you can emphasize that community engaged piece from start to finish, and it really kind of facilitates that piece.
Yeah, I would say that as a participatory tool, it provides some real concrete infrastructure, really set stages that have really specific focus topic areas on really like the brainstorming, the sorting and rating, and these really finite points. But all of it is generated from the expertise of the participants in the community at each phase. So for me, I feel like it's a really nice application of a research methodology and approach that's consistent with participatory research because it provides that infrastructure, but it's guided by the expertise of participants. For me, I think participatory research frames the role of the researcher as a facilitator, and I think concept mapping is a really nice application of that approach where really it's my job to create the setting, to support the process, to provide the tools, while also being flexible enough to meet the needs and being culturally sensitive and humble of those individuals who are participating.
This really comes together in a different way where you can start to put together a map of what all of these different features are in a visual way that I think the community members understand, their community leaders can understand, and hopefully can start moving towards making meaningful change that, while quotes might help supplement, might not quite get that same sort of impact. So I think for me, that's why I've tried to build it into my research and want to use it moving forward.
So now that you've met everyone, let's hear about the project planning phases.
The challenges can be, like any other approach, time, understanding of the topics over multiple sessions. But again, that's sort of my job as a participatory researcher, making sure that that's clear, being accessible, anticipating some of those challenges, but by also really creating a space where I'm constantly listening and responding to the needs of those who are willing to share their expertise and really valued partners in
Really, it was really ingenious because even though we had like the structure, it was really the participants that took over. So they came up with their list. They were the ones that did their summary. They were the ones that kind of like put these clusters together. And then afterwards, they were kind of the ones to kind of give meaning to those clusters. So I thought it was like really, really a great way of not only a participant tell us different nuances that maybe we didn't think about, but it also establishes things that we have already thought about. So for instance, a lot of the times what you thought was like important for moms wasn't as important when you broke it down. And the way staff see things, the way the staff saw things were very different from what moms did. So I thought it was a great experience, and it was a great alternative to
Now I'm thinking about like how much I enjoyed kind of like the engaged nature of concept mapping. Wouldn't it have been cool if I had, you know, brought in some stakeholders earlier on in even just the forming of the focal prompt. So for example, you know, including whether that would be staff or birth center clients or I mean anybody really, you know, because it's one thing to kind of brainstorm and pilot questions with your colleagues, but it's a whole nother thing if you're, you know, actually bringing that target population in.
They are not merely research subjects, they are actual participants in your research, and I think that's extremely valuable as well. And really thinking about your project and trying to think it through all the way, like, you know, what will I do with this data? And are the questions we're asking going to be answered by the way we've set this up, or do we need to set it up a little bit differently to get a deeper answer or a more complete answer?
So while there are 6 steps to concept mapping, there are 3 times that you really, as a researcher, you interface with your community partners or your stakeholders or your participants, and they are brainstorming, sorting and rating, and interpretation. So there are the 3 sessions that you will facilitate, and the great strength about concept mapping is that you can do them in a variety of ways. You can do them all in person, you can do them all online, or you can really think about what's best for your community and maybe do a mixture of both.
Doing this in person in particular, I think the 3 sessions where you're interacting with participants feel very different. You know, brainstorming starts out, it's more of a group activity, everybody's throwing out their ideas to put on this one giant list they're trying to build. It still has a sort of interactive group feeling to it. Sorting and rating feels a lot different for participants. It's such an individual activity where you're being asked to sort however many items that particular project has come up with. I think the projects I've been involved in have been anywhere from sort of 50 to 60 up to over 100, and so that is a lot you're asking people to do in terms of getting all of these items. We typically use pieces of paper with each item on it that they're then sorting into individual piles into whatever groups are meaningful for them. Some people can do that fairly quickly and find it fun, but other people that's really challenging. It's sort of a hard abstract idea to sort of group things thematically, and you kind of have to help walk them through it. But it's time consuming as well for many individuals. The rating process is in some ways a little bit more straightforward because you're using Likert scale types of questions, but at the same time, if you're doing 2, 3 rating scales and you have 75, 100 items, it's also very time consuming for participants. So it can feel like I'm just in my own little space, doing my own little activity, and how does this connect to everything else? And so having that up front, I think we found that setting expectations when you come in of why are we doing this, and helping people see how that connects to the larger project of whatever we're trying to understand, the research question, and how it's going to be ultimately used, and why it's so important that we're getting their perspectives, because this is how we're getting that each individual in the room is contributing their ideas. They're showing us how they think these things connect, and the person next to them is showing us how they think these things connect. And you're in another community, and they're showing us how they think these things connect. And we're able to then pull that all together. And if we don't have each person's input, we can't make these great visual maps that we're able to come back to them with in the interpretation session. So it is time consuming, it can be confusing, but I think once participants sort of get through it, and then you come back to them with that information, it's so much more meaningful knowing that they've actually contributed.
And I think it's empowering for the participants as well. I think initially you're concerned that they may not want to come back to the next sessions, but once you do get them there and they become part of the process, they aren't just subjects, they're part of the process, they're almost part of the research team at that point, and they really enjoy that.
A challenge with these steps was that I conducted them all online. So in those initial stakeholder interviews in my planning process, I mentioned that the participants said they wanted to have kind of this online piece up front for flexibility and then do the interpretation sessions in person at the end. So that was great in that my participants could do it on their own time. It was flexible. They could stop. They could work on it for a little while, stop, come back to it, do it in their, in the comfort of their own home. They didn't have to drive into Pittsburgh for a day to conduct these steps, or for a weekend. But it was also a challenge because instead of it being conducted over a day or 2 days, these steps took several months because I had to allow participants the time to complete them, in a realistic time frame. And I spent a great deal of time tracking people down. So, I would send them their information to log in, and then I would see, okay, after a week they haven't done this step yet, so let me follow up with them with an email, and then after 2 weeks, I might follow up with a phone call, and just try to see if there's anything I could help them with the process or if they had any questions. And in general, my plan worked because people eventually finished the steps, but it did take longer because I did it online, and you have to do a lot of tracking down. It's not everybody in one room doing it at the same time together. I will say, though, that something that helped was that I laid out this protocol for reminders before the study even began. So I told them that I would be following up with them on a regular basis to help to make sure they were able to complete the steps. So they knew that I wasn't just harassing them with phone calls and emails. They knew ahead of time I would be reaching out to them. But it also gave me some sort of stopping point where, okay, if I reached out to this person through email and a phone call and an additional step, at this point I'm not gonna keep asking them.
I prefer brainstorming sessions in person because you get the dynamics of a focus group discussion, which in and of itself is interventional. People get to come together and meet others who are rallying around the same cause, and they get to build connections.
The thing I really love, I think, my experience with using concept mapping is you're involved in this brainstorming approach, which feels sort of, I'll use the term the community and other stakeholders use it, a little fuzzy and out there, but then you're able to use the tools and the software itself to then generate, this point map, and then use the software to then say, here are the clusters that come from it, but then hovering over it with the, mouse each time and say, depending on the project with the young people, with the kids you worked with and here in Pittsburgh, and say, even say like, well, number 34, well, whose item was that? Oh, that's your item, right? So being able to reflect back on the data with the participants and say there's nothing magical that happened between when you did your brainstorming here. This is actually your data. Mm-hmm. And so seeing people lean into that approach and recognizing, oh, we can move that. We can manipulate the data in a way, is it 4 clusters and 3 clusters or 2 clusters, and helping them guide that approach.
As far as looking back on the analysis step and process, I think this is very interesting, maybe a little overwhelming because there are so many potential results and so many ways to examine those results. So again, always kind of having that plan laid out ahead of time as to what questions you're going to ask and what analysis you're going to perform is important, because you could just go down the rabbit hole of all sorts of different graphs and correlations and all sorts of different comparisons.
So then when they finally see the map and the points kind of like overlaid on the cluster map, it's like, oh, okay, get it. Stuff that's closer together wants to be grouped together. We talked about how stuff that kind of floats by them on their own, points that float on their own, or are in the middle. We could do, the software just makes it so easy. We could do like the spanning analysis, and I could show you, oh, well, this is in the middle, but it also, y'all said it was related to like everything, so maybe that's why it's in the middle. But so it really, I think it helps them to kind of just like understand it's a really like quick way of absorbing the information.
Oh, I think it becomes much easier, particularly when we have, you know, a large number of concepts and then they get put together. And I think even for the sorting and rating session, it's still kind of obscure, you know, to the participants of what this is actually going to be. I mean, it's kind of fun to do it, but then you sit around and say, well, what are they actually going to get from this? And then you come back to that next session and you have this concept map and you have those layers, and you get, as a participant, you get the sense of the weight of your answers, the relationship of your answers to everyone else's, and the idea of seeing that this, what seemed like kind of happenstance or kind of random second session of the sorting and rating actually ends up to be this beautiful picture of how these concepts actually do relate to one another. And you sit there and you say, yeah, that does make. Person came back to all 3 sessions. By that 3rd session, they were just all in. There's no question about it whatsoever. People felt bad if they couldn't come to a second session even after the first session. They really wanted to see what the data was going to say back to them for that last session, that interpretation session. And the interpretation sessions for most just went beyond anything. I mean, I told you they'd buy-in. They were giving us answers, right? Like this is what needs to happen because look at that. And so, yeah, the buy-in was tremendous.
As far as the interpretation sessions, this was probably my favorite piece of the concept mapping study. These were done in person for my study, so brainstorming, sorting, and rating were done online, and then my participants wanted the interpretation sessions to be in person. So they, I kept them in their separate participant groups just to kind of make sure that everyone felt comfortable speaking. You know, if you don't want a patient navigator to be in there with their administrator and not feel that they can open up and be honest. So I kept my 3 participant groups separate, and I offered multiple times for them to come so they could pick the date and time that worked best for their schedule. And the interpretation sessions were about 2 hours, and I offered food and assistance with transportation, and if they needed to call, I had one participant get sick that day and she just wanted to call in. I allowed her to call in to participate, so I was very flexible. I added additional dates and times when people couldn't come to the ones I already had scheduled. So I tried to do all the steps I could to make it where people could participate. But anyways, the interpretations were great. They were fun. And this, I think, is where, while the brainstorming, sorting, and rating are all important steps and they get you to the interpretation session, this is where so much good information was shared. And maybe it's different in other studies where you do it all in person and everybody's already been interacting, but for my study, this was the first interaction they had with me as the researcher, their first interaction with other participants, and so there was a lot of good interaction and good information shared. Also, the interpretation sessions, this is where it became very clear to me, because part of my study was to compare the results amongst my 3 different groups. Are patient navigators, administrators, and patients all on the same page, or are they not? And so in the sorting and rating phase, you know, there were some slight differences, but nothing really significant. But when you got to the interpretation sessions, these differences in the groups became a lot more clear, which was nice to be able to see that. This is also the step which you'll learn as part of concept mapping, is where you really come up with your concrete action steps for what to do next, which is awesome, which is helpful for a researcher, because not only am it's not me sitting and interpreting the data and saying, I think this is clearly what we should do next. I was able to kind of get this consensus from my participants about, yes, we agree, these are the next steps we should take, which was really helpful. Another part about the interpretation sessions that I thought was fun was that you could see participants were really excited to see kind of all their hard work kind of coming to this end of producing action steps and producing a map and kind of really getting to see what might happen with the information that they provided and the time they gave to your study. So they were really excited to see their individual contributions and how they, were really engaged in the research process.
So what really worked well is that after I summarized how we got to the concept mapped, I allowed every participant the opportunity to digest it individually. So they had time to look at the concept mapped individually and look at the clusters, analyze them, and come up with their own personal working theory. Then what they did is they took turns sharing with the greater group, and together we came up with one consensual working group theory for that participant stakeholder group.
So the interpretation process and element of concept mapping is really one of my favorite elements. Well, that's not true. Kind of like different phases of the approach and the method for different reasons. But the interpretation piece is one, especially from that participatory research side, is where you really have the opportunity to help guide the meaning of the so what and the how and why behind that data too. So you've gone through this approach with a group, they've brainstormed, you've developed a point map, then you've used that the concept mapping software then to develop what is the right cluster amount, and then to help go through and understand what do the clusters mean or not. So the interpretation phase is particularly important or exciting, I would say, for a project I mentioned here in Pittsburgh where we worked, again, a stakeholder group I didn't mention were school nurses. So it's really interesting to have them go through a brainstorming phase and a sorting and mapping and rating phase. And then they came up with this cluster grouping, and one of the clusters were sort of neighborhood stressors that came up. Well, I as an outsider or anyone could kind of look at those and say, well, make some understanding of how do those items in that point map link to asthma exacerbations. Well, it was really interesting to use the interpretation phase to say, well, could you look at those items and tell us a story? Link those items in a story to help us understand how stress might affect asthma, and draw pictures, right? And so it was really interesting because they took, I don't know if you've seen this before, but they took this picture they drew a picture of a child who was really angry. And they were surrounded, that child, with all the point map numbers.
Okay.
And they told a story of how, stress in the home and stress in the community and violence in the neighborhoods and other factors can affect this young person and affecting these asthma exacerbations. And this is what would happen when one happens and then another happens. And so they told these stories that then also the other school nurses were nodding and understanding. And so each group got to sort of develop a story interpreting each one of those clusters. And so that again brought the group closer. And that also organically, I think, led them to a place of, well, then what do we do about that?
Right.
What are the things that you can get to? And so it's a very action-oriented, participatory action, I think, guided approach where this isn't research for learning's sake, this is research for action's sake.
Now that we've talked through some of the different planning pieces, let's reflect by hearing some challenges and some successes and how concept mapping results were utilized.
In comparison to my other experiences in community-engaged research, concept mapping as a methodology is inherently participatory, especially in the utilization phase where all stakeholders get to come together and decide what they want to do with the results. So how do we want to use these results to effectuate change?
What was your reaction to the data and just being able to see the different types of maps that were created?
Yeah, and I think again, there's a lot of community health issues that are impacting the population. So from the 50 main topics that we gave the members and community to sort, rate, we could actually see groupings and understand how there were actually some topics that actually fell together. So really, with all those 50 topics, we were able to group it towards groupings such as prevention, chronic disease management, and actually coordination. So that was actually a nice way to actually take all those topics together and then really group them onto sort of main themes that really help the hospitals develop implementation plans to address those needs. Now, a great
aspect of the concept mapping that we actually employed is, we still looked at the epidemiological data and surveillance data of these communities to really complement what was going on in the communities. So I think that nice marry of the quantitative data, as we've seen from, the public, Allegheny County Public Health Department and the State Health Department, complementing it with the input that we were getting from the community, it was really nice to really see a picture of what really were the important health needs. So with that, the hospitals were very appreciative of that information, because it allowed them to really look at, well, now I know what the health needs of the community. Now let me pair that with the strength of the hospital and what we can actually do from the hospital side to really address those needs. So in that, we were able to develop implementation and strategic plans to that really addresses not only the needs of the community, but really pair with many of the community organizations across the area to really help address those needs. So it was a really nice marrying of different data sources, different data inputs, different angles to really actually do something actionable to really help address the needs of the community. From that data gathering, we actually developed specific hospital reports for each of those 13 hospitals. So really within a year and a half span, we developed specific and tailored reports that actually represent the information that was gathered for each of those hospitals. And so the hospitals took that information, they presented it to their board, and they actually made that report public so that everyone can actually see what's going on. In terms of implementation, then, those reports really set the foundation for what the health issues were for that next 3 years the hospitals were going to focus on.
So very excitedly with the Allegheny County Breast Collaborative, there's the concept mapping actually strengthened, I think, our relationship with all of the partners within the collaborative, because they saw us go and hit the streets and talk to people and bring back information, and they were very excited when we presented that data. And one of the members went ahead and got a grant to begin to address some of those disparities, those issues that were identified. And then that project led to other subsequent funding from the state level in understanding that, these disparities in Allegheny County, and if we address them and figure it out here, we'll be able to take it and apply to other places. So I think we are ahead of the curve in some ways of beginning to address the disparities issues. It is something for me as Komen, when I talk with people and say, well, these are the kinds of things we do with our money. We understand that in this community we may need more transportation, but in this community there's a definite interest in getting access to care at other places. And I think, we will be able to show some shifts in mammography. Obviously it'll take a little bit longer to see the readouts and the impacts of late stage diagnoses, but I think we're really on the right path to addressing those disparities now.
So would you do concept mapping again?
Oh, I want to do it every time, everywhere, all the time.
I think if there's a lot of people involved and there's a long process in terms of, or there's questions about the process of how to actually engage a lot of people, I think concept mapping is actually a great approach, because it really does engage a lot of people. It's a very dynamic approach. It's also very innovative in that it really does mix the quantitative and the qualitative together to really be able to extract information. Many of the other hospitals that tried to engage with the community, they had many focus groups, and there was a lot of just qualitative data that they had to actually go through. That wasn't the most efficient way of actually looking at the information. I think with the metrics that was resulted from the concept mapping was really a nice way to pare down a lot of rich information into some of the key areas. I think for hospitals, because we actually have to do this rapidly, and because we actually have to show results, the fact that you can actually take a lot of health issues and boil it down to some key concepts, I think really helped shape what really were the core areas and core aspects that the hospitals needed to focus on. So from that, I think there's lots of data out there. I think concept mapping was a great way to actually synthesize information into a more concise way. And it allowed the information to be more, I think, as more bite-sized and more implementable, tangible. So I think in that in itself was very helpful. So I think for a lot of community organizations who are trying to understand what are the needs of the community or how to actually approach some broader questions, like concept mapping is a great approach to being able to get some information that's useful and actually actionable.
Just, as you mentioned before, the richness of the data, but the experience itself as the researcher, as that person wanting to go into the community, it just gives you this relationship that you wouldn't have developed in any other way.
After the project, many participants came up to me to say that their favorite part of participating was that they had the opportunity to meet with others like them who shared their same concern.
Concept mapping, I think, has been a particularly effective and appropriate research approach and method, I should say, when really it's about formative learning about a topic. So the brainstorming phase is both, I think, really helpful in guiding developing some good groundwork and understanding of a particular topic from that really participatory, non-judgmental approach, which provides an opportunity for even just learning language, for developing relationship, for understanding what are tension points, really understanding the strengths, who are the real leaders within a community, even participating in that approach. So it's almost an intervention in that way, because it allows for some relationship building there, where it's just about everyone sharing their expertise. I'd say it's a strength of this, of concept mapping as a tool and as a method, is that it's flexible, I think, to be used in different settings. But I would also say that I think in the right hands, any method should be flexible in that way too. It's important, though, to clarify, and while I like concept mapping as a methodology, it's important to take that step back and say, is it appropriate here? Is this the right place and time to use it?
Right.
I would say that with any methodology.
Right.
And so making sure to match that to what the goals are. Advice for people from different sectors interested in concept mapping, I would say take the time to read a little bit about it, look at how the approach has been used, how this method has been applied, to learn about different topics. If there are any that are of interest with the organization that they work with or an academic setting, to look for some others, how it's been applied there. As a method, take the time to learn, practice a little bit. We really, when people come and we have the opportunity to engage community individuals in research, it is a gift. It's a gift that should be cherished. Mm-hmm. It should not be wasted. Mm-hmm. And so it's really up to us to do the research beforehand to learn. That's not to say that you won't make mistakes. If we make mistakes and we learn from them, they're not mistakes. So really, be willing to make that mistake, to own it in the moment and be like, my bad, I'm gonna try. And I'm really good at that. So I'm constantly learning, constantly making mistakes and learning from them too. And so I think don't be afraid to engage people that we're working with in that process. Don't be afraid to step back and start over when appropriate, and kind of.
Like I said, I really liked the opportunity that I had. And since it's a great way of marrying, qualitative with quantitative, I would definitely use this I'm very interested in maternal child health, so I would love to use this concept to maybe explain a little bit more of the health disparities that we see. Usually, a lot of the research is kind of always defining health disparities to like a socioeconomic standpoint, but this would actually reflect something beyond that. So you can't always, attribute something because of, cost or access. There might be
just give it a go, right? Trust the process, trust your partners. I really have been through so many different research partners and community partners, and at some point you just have to dive in, right? So what's really nice about concept mapping is that there are a series of steps. We know the 6 steps to concept mapping. We know the activities that you need to do. We know that you need to develop a focal prompt. You need to do your homework and plan for that. but at some point you just have to dive in and trust the process. And what I mean by that is that because there are so many different activities, there are actually so many different points to collect additional information, right? So you ask a focal prompt, hopefully you've designed it to elicit good responses that you can then sort and rate. But then I always say that the interpretation session will catch all the other pieces, right? That you can ask about everything else in the interpretation. And so I would just say, be prepared, read up, talk to your colleagues, but in the end, just jump in and trust the process.